Welcome to your orientation at Prince Charles Home Healthcare Agency, a place where we offer our clients a right to royalty care. Can you commit to offering royalty care? Welcome to Prince Charles Home Healthcare Agency. At Prince Charles Home Healthcare Agency, we are dedicated to providing exceptional care and support to individuals in need across Southside Virginia. Since our founding in 2009, we have remained committed to delivering high-quality, compassionate home healthcare services. Our founder, Tashana McElveen, plays a vital role in ensuring the success of our agency. She serves as your administrator, director of nursing, nursing supervisor, and compliance officer, bringing extensive experience and leadership to our team. Lindell Hairston serves as the staffing coordinator and community liaison for the Collinsville-Martinsville area. With over 8 years of experience in the home care industry, she brings valuable expertise in staffing coordination and community engagement to support both caregivers and clients. Lindsay Taylor serves as the Senior Staffing Specialist and Office Coordinator, bringing over 10 years of experience in the home care industry. Her expertise in staffing, office management, and client support plays a key role in ensuring efficient operations and high-quality care services. Cora Royal serves as the Receptionist and Community Liaison, bringing over 20 years of experience in the healthcare field. Her expertise allows her to efficiently manage clerical operations within the office, while fostering strong community connections to support the agency's outreach efforts. We are proud to introduce Mrs. Lucille, our Human Resources Director. She oversees all aspects of our onboarding process, ensuring a smooth transition for new team members. With over 25 years of experience in the healthcare industry, she brings a wealth of knowledge, compassion, and dedication to fostering a welcoming and supportive work environment for all employees. We are excited to have you join Prince Charles Home Healthcare Agency. This orientation session will introduce you to our policies, expectations, and workplace culture to help you feel confident and prepared in your role. Our goal is to provide you with the resources, guidance, and support needed to succeed. We value your contribution and are committed to fostering a positive and rewarding work environment. Welcome aboard. We look forward to working with you. Our founding story. Prince Charles Home Healthcare Agency was established in 2009 by Tashana McElveen in loving memory of her brother, Charles Lamont Haley. Charles, a dedicated member of the military, tragically lost his life in a car accident in 2003. He had a deep passion for caring for the elderly and children, inspiring Tashana to create a legacy that honors his commitment to helping others. Founding this agency allowed her to stay connected to his mission and their shared passion for providing compassionate care to those in need. Our commitment: foster a culture of professionalism, compassion, patience, and understanding, ensuring the highest quality care for our clients. Maintain a positive and safe work environment that enhances the experience of both employees and clients. Promote a collaborative, team-oriented approach that supports the needs of our caregivers and the individuals we serve. During your orientation, you will complete required paperwork, review company policies, clarify job expectations. You will be compensated for your orientation time. If you lose or damage your employee handbook, please notify a staff member for a replacement. Virginia is an at-will employment state, meaning that either you or the company can terminate employment at any time, with or without notice, and for any lawful reason. While we are committed to fostering a stable and supportive work environment, it is important to understand this policy as part of your employment with us. Prince Charles Home Healthcare Agency is committed to maintaining a workplace free from discrimination and harassment in accordance with EEOC guidelines. We strictly prohibit discrimination based on race, color, religion, age, sex, national origin, physical or mental disability, veteran status, or any other protected category under federal, state, or local laws. We uphold fair hiring practices and workplace policies that foster equity, inclusion, and respect for all employees. If you believe your rights have been violated, we encourage you to report your concerns to management or HR immediately. All reports will be handled with confidentiality and professionalism to ensure a safe and supportive work environment. Our company is committed to providing equal employment opportunities to all qualified individuals, including those with disabilities. In accordance with the Americans with Disabilities Act, ADA, We are dedicated to ensuring a workplace that is accessible and inclusive by providing reasonable accommodations where appropriate. If you require an accommodation to perform the essential functions of your job, it is your responsibility to notify management or HR as soon as possible. Upon request, we may ask for your input on the type of accommodation needed or any functional limitations related to your disability. Additionally, when necessary and appropriate, we may request your written permission to obtain relevant information from your physician, medical provider, or rehabilitation professional to help determine suitable accommodations. All medical information will be handled confidentially in compliance with ADA regulations. We are committed to fostering an inclusive, supportive, and compliant work environment for all employees. If you have any questions or need assistance, please reach out to HR or management. Prince Charles Home Healthcare Agency is committed to maintaining a workplace free from harassment, discrimination, and retaliation in accordance with EEOC guidelines. We strictly prohibit harassment of any kind, including but not limited to verbal, physical, visual, or online conduct that creates a hostile, intimidating, or offensive work environment. This policy applies to employees, supervisors, managers, clients, vendors, and third parties interacting with our workplace. Harassment based on race, color, religion, sex, including pregnancy, gender identity, and sexual orientation, national origin, age, physical or mental disability, genetic information, or veteran status is strictly prohibited. This includes unwelcome advances, inappropriate comments, offensive jokes, intimidation, or any conduct that interferes with an individual's work performance or well-being. Employees who experience or witness harassment are encouraged to report it immediately to. At Prince Charles Home Healthcare Agency, we are committed to fostering a safe, respectful, and inclusive workplace. In accordance with EEOC regulations, we strictly prohibit sexual harassment of any employee by another employee, supervisor, client, vendor, or third party. Similarly, harassment of third parties by our employees is also strictly prohibited. Sexual harassment includes unwelcome sexual advances, requests for sexual favors, and other verbal, physical, or visual conduct of a sexual nature that creates a hostile, intimidating, or offensive work environment. Examples of prohibited conduct include, but are not limited to, unwelcome sexual advances or requests for sexual favors, inappropriate touching, groping, or physical contact, sexually suggestive comments, jokes, or innuendos, displaying or sharing sexually explicit images, emails, or materials, making derogatory remarks about an individual's gender or sexual orientation, threats, coercion, or retaliation related to sexual conduct, reporting and enforcement. If you experience or witness sexual harassment, we encourage you to report it immediately to management or HR. All complaints will be promptly and thoroughly investigated in a confidential and non-retaliatory manner. Retaliation against employees who report harassment in good faith is strictly prohibited. We urge all employees to be mindful of their actions and to help us maintain a harassment-free workplace. If you have any concerns, please do not hesitate to seek assistance from HR or management. Reporting sexual harassment. If you experience or witness sexual harassment, report it immediately to HR or management. We will promptly investigate all complaints and take appropriate corrective action in a confidential and non-retaliatory manner. If you believe your complaint has not been addressed appropriately, or if you prefer to report harassment outside of the company, you have the right to file a charge with the Equal Employment Opportunity Commission, EEOC. How to file a complaint with the EEOC Protection Against Retaliation. Retaliation against employees who report harassment or participate in an investigation is strictly prohibited. Anyone found retaliating will be subject to disciplinary action, up to and including termination. We urge all employees to be aware of their rights and help maintain a harassment-free workplace. If you have concerns or questions, please contact HR or management. At Prince Charles Home Healthcare Agency, we take all harassment complaints seriously and are committed to ensuring a thorough, fair, and prompt investigation. Our investigative process follows these steps. Filing a complaint. Employees who experience or witness harassment are encouraged to report the issue immediately to HR, management, or a designated company representative. Complaints may be submitted verbally or in writing, and employees may request confidentiality where appropriate. Acknowledgement and preliminary review. Upon receipt of a complaint, the company will acknowledge the report and conduct an initial assessment to determine the nature of the allegation. If the claim falls under harassment, discrimination, or retaliation, an investigation will be formally initiated. Investigation process. An impartial investigator, HR representative, compliance officer, or external investigator if necessary, will be assigned. The investigator will interview the complainant to gather detailed information, interview the accused individual, and allow them to respond to the allegations. Gather evidence, including emails, messages, witness statements, and relevant documents. Conduct witness interviews, ensuring confidentiality to the extent possible. Findings and resolution. After completing the investigation, a written report summarizing the findings will be prepared. If harassment is substantiated, appropriate corrective and disciplinary actions will be taken, which may include verbal or written warnings, mandatory training, suspension, termination, if warranted. If the complaint is not substantiated, the company will provide a clear explanation of findings to the complainant. Protection against retaliation. Retaliation against employees who file complaints in good faith is strictly prohibited. If an employee experiences retaliation, they should report it immediately for further investigation. To ensure fairness and integrity, all harassment investigations will be conducted with the utmost confidentiality. Information related to complaints, witness statements, and investigative findings will be shared only with those directly involved in the process on a need-to-know basis. We take all reports seriously, and employees are expected to act responsibly when reporting concerns. While we encourage openness in reporting harassment, knowingly making false accusations is a serious matter and may result in disciplinary action. Maintaining confidentiality throughout the investigation process helps protect the rights of all parties involved and fosters a safe and respectful workplace. At Prince Charles Home Healthcare Agency, LLC, we are committed to fostering a professional, respectful, and inclusive work environment. Workplace bullying is strictly prohibited. The following behaviors constitute workplace bullying. However, this list is not exhaustive and serves as an example. Examples of workplace bullying: nonverbal hostility, staring, glaring, or other intimidating gestures; exclusion or social isolation, deliberately ignoring or ostracizing an employee; excessive monitoring or micromanaging; unwarranted scrutiny beyond reasonable supervision; work-related harassment; overloading employees with excessive tasks, unrealistic deadlines, or assigning meaningless work; unequal treatment, holding an employee to a different standard than the rest of their team; public humiliation, ignoring, interrupting, or dismissing an employee in front of colleagues; personal attacks, yelling, angry outbursts, excessive profanity, or name-calling; encouraging hostility, persuading others to turn against a targeted employee; work sabotage, deliberately undermining or obstructing a coworker's productivity; stalking, repeated unwanted following or surveillance; unwelcome physical contact; any non-consensual touching; invasion of personal space; intentional encroachment beyond comfort levels; obstruction of work; disrupting an employee's ability to perform their job, e.g., flooding their inbox with unnecessary emails; verbal abuse, repeated use of derogatory remarks, insults, or offensive language; hostile conduct, any behavior that a reasonable person would find offensive, intimidating, or unrelated to legitimate business interests. Reporting and resolution process. Early intervention is the most effective way to address and resolve workplace bullying. While there is no strict timeline for reporting, employees are strongly encouraged to report any incidents promptly. Prince Charles Home Healthcare Agency, LLC, will take immediate and appropriate action to address and prevent further incidents. However, this can only be achieved with the cooperation of all employees. How to report a workplace bullying concern. Employees should report complaints either verbally or in writing to their supervisor, the human resources director, or the administrator before the situation escalates. Employees are not required to report their complaint to their immediate supervisor if they feel uncomfortable. Employees may also address the offender directly to state that the behavior is unwelcome and request that it stop. Commitment to action. Prince Charles Home Healthcare Agency, LLC, will make every effort to investigate and resolve workplace bullying concerns before they become severe or pervasive. Retaliation against employees who report bullying in good faith is strictly prohibited. Maintaining a safe, professional, and respectful workplace is a shared responsibility. By addressing workplace bullying promptly and effectively, we ensure a positive work environment for all. In accordance with the Immigration Reform and Control Act, IRCA, all new employees must complete the Employment Eligibility Verification Form 9 as a condition of employment. Employees must also provide valid documentation to establish both identity and authorization to work in the United States. If an employee is authorized to work in the U.S. for a limited time period, they are responsible for providing updated employment authorization documents before their current authorization expires. Failure to provide proof of continued work eligibility may result in termination of employment in compliance with federal regulations. We are committed to complying with all immigration laws and ensuring a lawful and inclusive hiring process. If you have questions regarding employment verification, please contact HR or management for assistance. Understanding your employment classification is important, as it affects your benefits, work expectations, and scheduling. Employment classifications full-time. Employees scheduled to work 32 hours or more per week. Part-time. Employees scheduled to work less than 32 hours per week. Per diem. Employees who work on an as-needed basis, depending on company needs and availability. Introductory period. All new employees will complete a 90-day introductory period at the beginning of their employment. This period allows employees to determine if the role aligns with their skills and career goals. Supervisors to evaluate work performance, job suitability, and overall fit within the organization. Completion of the introductory period does not guarantee continued employment. Employment remains at will, meaning either the employee or the company may terminate the employment relationship at any time, with or without cause, in accordance with company policies and applicable laws. For any questions regarding your employment classification or introductory period, please contact HR or your supervisor. Here's what you need to know about your pay schedule and timekeeping responsibilities. Pay schedule. Paychecks are issued bi-weekly, every 2 weeks, based on the hours you have worked. Deductions. Applicable taxes and any voluntary benefit contributions will be automatically deducted from your paycheck. Timekeeping responsibility. To ensure accurate and timely payments, it is essential that all caregivers complete all required EVV documentation by the designated deadline, which is Sunday before payroll. All administrative staff are required to have their timesheets submitted by Monday before payroll by 8:30 a.m. Payroll discrepancies. If you notice any errors or have questions about your paycheck, please notify HR or payroll as soon as possible for resolution. For any payroll-related questions, don't hesitate to reach out to HR or your supervisor. Accurate timekeeping is essential to ensure proper payment and compliance with company policies. All employees must follow the designated electronic visit verification, EVV process, and complete the required EVV documentation to confirm hours worked. Clocking in and out procedures. Caregivers must clock in at the beginning and end of each shift using the client's phone or an approved EVV mobile application. Administrative staff must clock in at the start and end of their shift, as well as for meal breaks. Under no circumstances should an employee clock in or out on behalf of another employee. Any violation of this policy may result in disciplinary action. Lunch breaks and payment policies. Caregivers' lunch breaks are paid. Administrative staff lunch breaks are unpaid, and they must clock in and out accordingly. If you have any questions regarding timekeeping procedures or EVV compliance, please reach out to your supervisor or HR department for assistance. Below are important details regarding payroll and paycheck distribution. Pay schedule. Employees are paid bi-weekly, every other Friday, for the pay period that ends on the previous Sunday. If a scheduled payday falls on a holiday, paychecks will be issued on the business day before the holiday. Paycheck pickup process. Paychecks will be available for pickup after 2 p.m. from the administrator or an administrative staff member. If you need someone else to pick up your paycheck on your behalf, you must contact the office in advance to provide authorization. Ensure the authorized individual presents a valid photo ID. The individual must sign a payroll pickup form upon receipt of the paycheck. For any payroll-related questions or concerns, please reach out to HR or the payroll department. In accordance with IRS regulations, the company is required by law to make certain mandatory deductions from your paycheck each pay period. These deductions typically include federal income tax based on IRS withholding tables in your W-4 elections, state and local taxes where applicable, Social Security, FICA, and Medicare taxes. Additional deductions, depending on the state of employment and voluntary benefit selections, additional deductions may apply, including but not limited to health insurance premiums, retirement plan contributions, other voluntary benefits elected by the employee, pay stub and year-end reporting. All deductions and contribution amounts are itemized on your pay stub each pay period. These deductions are reported annually on your Form W-2, wage and tax statement, which is provided to you for tax filing purposes. For questions regarding payroll deductions, withholding elections, or tax forms, please contact HR or payroll services. We value employee growth and development. To ensure continued success, we conduct regular performance reviews to assess progress and provide feedback. Annual performance reviews. Each year, on or around your anniversary date, a member of management or the administrator will review your job performance, discuss accomplishments, and help establish new performance goals. Purpose of reviews. Our performance review process fosters clear communication between employees and management, ensuring alignment with job expectations, professional development, and career potential within the company. Introductory period review. New employees will typically receive a performance review at the end of their introductory period to evaluate their progress and fit within the organization. Compensation adjustments. While performance reviews provide an opportunity for growth discussions, they do not guarantee pay increases. Any salary adjustments are based on company policies, financial considerations, and management discretion. For questions about the performance review process, please reach out to HR or your supervisor. In compliance with the Fair Labor Standards Act, FLSA, and applicable state labor laws, employees are classified as either non-exempt or exempt, which determines their overtime eligibility and pay structure. Non-exempt employees. Non-exempt employees are entitled to overtime pay for all hours worked beyond 40 hours per work week at a rate of 1.5 times their regular hourly wage, as required by federal and state laws. Some states may have additional daily overtime requirements based on hours worked in a single day. Exempt employees. Exempt employees are classified under specific FLSA exemption categories such as executive, administrative, professional, or outside sales roles. Exempt employees are paid a fixed salary and are not eligible for overtime pay, regardless of hours worked beyond 40 hours per week. Their salary is not subject to deductions based on hours worked, except in limited, legally permitted circumstances, such as unpaid leave under the Family and Medical Leave Act, FMLA, or other applicable policies. For questions regarding your employment classification, overtime eligibility, or payroll policies, please contact HR or payroll services. Exempt employees are paid on a salary basis and are generally not subject to pay deductions. However, in compliance with the Fair Labor Standards Act, FLSA, and state laws, salary deductions may be made in the following circumstances: full-day absences for personal reasons, excluding sickness or disability; full-day absences due to sickness or disability, provided a compensation plan, policy, or practice exists to cover such absences; full-day absences before eligibility under a compensation plan, policy, or practice, or after exhausting replacement compensation for such absences; suspensions for serious safety violations related to workplace policies or conduct of major significance. Salary deductions will be made only in accordance with federal and state labor laws. If you have concerns regarding improper deductions, please contact HR or payroll services immediately. In accordance with the Fair Labor Standards Act, FLSA, and applicable state laws, exempt employees may also be subject to salary deductions under the following circumstances: Full-day suspensions for violations of workplace conduct policies, including but not limited to sexual harassment, workplace violence, or other serious policy infractions. Prorated salary adjustments for actual time worked during the first and last weeks of employment, ensuring compensation aligns with the number of days worked. Unpaid leave taken under the Family and Medical Leave Act, FMLA, applied in compliance with federal regulations. Negative paid time off balances, deducted in whole-day increments only, when an employee has exhausted available PTO. All salary deductions will be made in strict accordance with federal and state labor laws. If you have any concerns regarding improper deductions, please contact HR or payroll services immediately. In accordance with the Fair Labor Standards Act, FLSA, and applicable state labor laws, the following overtime policies apply. Non-exempt employees are entitled to overtime pay at 1.5 times their regular hourly rate for all hours worked beyond 40 hours per work week, or as required by state law. Employees must obtain prior approval from their supervisor or management before working overtime. However, overtime worked must be compensated even if pre-approval was not obtained. Unauthorized overtime may result in corrective action, but will still be paid in compliance with wage and hour laws. Some states have daily overtime laws, requiring overtime pay for hours worked over a certain threshold in a single day. Employees should familiarize themselves with state-specific requirements. For any questions regarding overtime eligibility, approval processes, or payroll, please contact HR or payroll services. We recognize the following company holidays: New Year's Day, Martin Luther King Jr., Day Memorial Day, Juneteenth, June 19th, Independence Day, Labor Day, Thanksgiving Day, Christmas Day, Holiday, Pay and Work Guidelines. Administrative staff receive 5 paid holidays per year. Caregivers are not required to work on recognized holidays. If caregivers choose to work on a holiday, they will be compensated at their regular pay rate, no additional holiday pay. Holiday pay for administrative staff will be based on the accumulated hours worked during the holiday week. For any questions regarding holiday schedules or pay, please contact HR or payroll services. Vacation and sick leave must be planned in advance and approved by management. This policy applies exclusively to full-time administrative staff who are eligible for paid vacation time based on the following guidelines. Vacation accrual. After 1 year of employment, employees are entitled to 5 days of paid vacation. After 2 years of employment, employees are entitled to 10 days of paid vacation annually. Vacation pay is calculated proportionally based on the number of hours an employee is scheduled to work. Leave and carryover policy, sick leave, bereavement leave, and vacation days cannot be carried over into the following year. Unused vacation days are the only type of leave eligible for payout upon termination or resignation. For any questions regarding vacation scheduling, approval, or leave policies, please contact HR or your supervisor. This policy applies exclusively to full-time administrative staff. We recognize the importance of scheduled breaks to maintain productivity and well-being. The following break and meal period guidelines apply to administrative employees. Rest breaks. Administrative employees are entitled to 2 10-minute paid rest breaks. Rest breaks must be taken as scheduled and cannot be skipped in exchange for early departure. Breaks should not be taken within the final hour of the workday. Meal breaks. Administrative employees are required to take a 30-minute unpaid meal break each workday. Meal breaks must be scheduled in coordination with supervisors to ensure operational coverage. Your immediate supervisor is responsible for approving and scheduling all breaks and meal periods to maintain compliance with company policy and labor laws. For any questions or concerns, please contact HR or your supervisor. This policy applies to administrative employees only. In accordance with the Family and Medical Leave Act, FMLA, eligible employees may take unpaid, job-protected leave for qualifying family and medical reasons. Eligibility requirements to qualify for FMLA leave: an employee must have worked for the company for at least 12 months, have completed at least 1,250 hours of service in the 12 months preceding the leave request. Qualifying reasons for FMLA leave: eligible employees may take up to 12 weeks of unpaid leave in a 12-month period for the following: the birth, adoption, or foster placement of a child. Leave must begin within 6 months of birth or placement. To care for an immediate family member, spouse, child, or parent with a serious health condition. To take medical leave when the employee is unable to work due to a serious health condition. Military family leave provisions. Employees may take up to 26 weeks of FMLA leave to care for a covered military service member, including members of the Armed Forces, National Guard, or Reserves, who is undergoing medical treatment, recuperation, or therapy due to a serious injury or illness. This leave is available to an eligible spouse, son, daughter, parent, or next of kin under military caregiver leave. FMLA leave guidelines. Employees must substitute accrued sick leave or vacation time for all or part of their FMLA leave. Paid time off, PTO, and holiday benefits will not accrue while on FMLA leave. Employees must provide at least 30 days advance notice when requesting FMLA leave, whenever possible. FMLA leave does not permit outside employment during the leave period. For more details regarding FMLA eligibility, leave requests, or return to work procedures, please contact HR or your supervisor. We comply with federal and state labor laws regarding jury duty obligations. Employee rights and responsibilities. Employees summoned for jury duty will be granted unpaid leave to fulfill their civic duty. Exempt employees may receive paid time off when required by state and federal wage and hour laws to ensure compliance. Employees must notify their supervisor immediately upon receiving a jury duty summons and provide a copy for record keeping. Returning to work. If an employee is excused from jury duty before the end of their scheduled work shift, they are expected to return to work for the remainder of their scheduled hours. For any questions regarding jury duty leave policies, please contact HR or your supervisor. We support every employee's right to vote in state, federal, general, primary, and special elections. In accordance with state and federal labor laws, the following policies apply. Time off for voting employees whose work schedules do not allow at least two consecutive hours to vote, while the polls are open, may request up to two hours of unpaid leave to vote. Exempt employees may be provided paid voting leave if required by state or federal wage and hour laws. Notification and documentation. Employees must notify their supervisor in advance if they require voting leave. Some states may require employees to provide proof of voting, such as a voter's receipt. Please check with HR regarding your specific location's requirements. For any questions regarding voting leave eligibility, please contact HR or your supervisor. Prince Charles Home Healthcare Agency complies with the Uniformed Services Employment and Reemployment Rights Act, USERRA, and applicable state laws to protect the employment rights of employees called to active duty, training, or other military obligations. Military Leave Guidelines Advance Notice. Employees must provide written or verbal advance notice of their military service to their manager or HR, unless military necessity prevents advance notice. Military orders. A copy of official military orders should be submitted as soon as possible to arrange leave. Use of paid leave. Employees may choose to use accrued vacation time during their military leave, but they are not required to do so. Reemployment and benefits protection. Employees must notify their manager of their intent to return to work in accordance with USERRA guidelines and applicable law. Health and retirement benefits may continue to accrue during the leave period, subject to federal and state regulations. Upon return, eligible employees will be reinstated to their same or equivalent position with seniority, status, and benefits intact, as required by law. For any questions regarding military leave eligibility, benefits, or return to work procedures, please contact HR. Prince Charles Home Healthcare Agency complies with state and federal laws regarding jury duty and witness leave to ensure employees can fulfill their legal obligations without penalty. Jury duty leave. Employees summoned for jury duty will be granted the necessary time off without pay to serve. Exempt employees may receive paid leave for jury duty when required to comply with state and federal wage and hour laws. Employees must notify their supervisor as soon as possible after receiving a jury duty summons. Witness leave. Employees subpoenaed or required to appear in court as a witness will be granted unpaid leave in accordance with state law. Employees must provide advance notice to their supervisor and submit documentation of the court requirement upon request. Returning to work. If released from jury or witness duty before the end of the workday, employees are expected to return to work for the remainder of their scheduled shift. For any questions regarding jury duty or witness leave, please contact HR or your supervisor. Prince Charles Home Healthcare Agency complies with the Americans with Disabilities Act, or ADA, the Family and Medical Leave Act, FMLA, and applicable state and federal laws regarding disability leave. Eligibility and duration. Employees who have completed at least 3 months of continuous employment may be eligible for unpaid disability leave due to non-occupational illness, injury, or pregnancy-related disability. Disability leave shall not exceed 12 weeks, unless an extension is required as a reasonable accommodation under the ADA. Requesting disability leave employees must submit a written request for leave, along with a doctor's certification stating the nature of the disability. The anticipated return to work date. Requests for disability leave beyond the eligibility period may be considered as a reasonable accommodation in compliance with the ADA. Health insurance and benefits. The company will continue providing medical insurance coverage for employees on approved disability leave for the first month. Employees must continue paying their portion of the monthly insurance premium. After the initial period, employees may continue medical coverage by making arrangements with HR to pay the full monthly premium in advance. Return to work process. Employees must provide at least one week's advance notice before returning to work. A doctor's certification confirming the employee is medically able to resume normal job duties is required. Employees will be reinstated to the same or a similar position, subject to staffing and business requirements. Job protection and termination disability leave may run concurrently with other leave, such as FMLA leave, where permitted by state and federal laws. Continued absence beyond the approved disability leave period, as determined by a physician, will be treated as a voluntary resignation from employment. For questions regarding disability leave, job protection, or benefits, please contact HR. Under special circumstances, employees who have completed at least one year of continuous employment may request an unpaid leave of absence for compelling personal reasons. Approval and eligibility. Leave requests must be submitted in writing and are subject to approval by the employee's immediate supervisor. A leave of absence will only be granted after all earned vacation time has been exhausted. Approved leaves cannot exceed the maximum duration set by company policy, during which no additional benefits will accrue. Health insurance and benefits. The company will continue to provide medical insurance coverage for 1 month after the request during the approved leave period, as required by law. Return to work. Upon returning, the company will make reasonable efforts to reinstate employees to the same or a comparable position based on staffing and business needs. For any questions regarding leave eligibility, approval, or benefits, please contact HR or your supervisor. Prince Charles Home Healthcare Agency is committed to maintaining a safe work environment and ensuring compliance with workers' compensation laws and reasonable accommodation requirements under applicable federal, state, and local laws. Reporting workplace injuries. All workplace injuries must be reported immediately to management to ensure eligibility for workers' compensation coverage. Failure to report an injury in a timely manner may jeopardize your ability to receive benefits, as required by state law. Employees are encouraged to alert management to any hazardous conditions or unsafe workplace practices that could lead to or contribute to workplace accidents. Reasonable accommodations. The company will make reasonable efforts to provide accommodations for employees with work-related injuries or medical conditions when the accommodation is medically necessary, feasible, and does not impose an undue hardship on the company. Accommodations will be assessed in accordance with the Americans with Disabilities Act, AADA, and relevant federal, state, and local regulations. For further information regarding workers' compensation claims, safety concerns, or accommodation requests, please contact HR or your supervisor. We understand that unexpected medical expenses due to injury or illness can significantly impact your financial security. To help protect you and your eligible family members, we offer a comprehensive insurance benefits package to regular full-time employees who have completed 90 days of employment. Available insurance benefits. Effective the first of the month following 90 days of employment, eligible employees may enroll in the following insurance programs. Health insurance, 100% of the employee's portion is paid by the employee. Life insurance, the employee pays 100% of the employee's portion. Dental insurance, employee paid 100% with the option to purchase coverage for family members. Disability insurance, long-term option, available for purchase through payroll deduction. Since the employee funds this insurance, no taxes are deducted when benefits are utilized. Additional insurance options. Employees may purchase other voluntary insurance plans with premiums deducted directly from their paycheck. Eligibility and enrollment participation in the insurance program is subject to eligibility requirements and official enrollment acceptance. The company reserves the right to modify, terminate, suspend, or cancel any insurance plan without prior notice if necessary due to business or operational circumstances. Plan details and additional information. Employees will receive a group insurance booklet, which outlines benefit schedules, coverage details, and policy terms. For further information or assistance with enrollment, please contact the Human Resources Department. Under the provisions of the Federal Consolidated Omnibus Budget Reconciliation Act, COBRA, you and your covered dependents may be eligible to continue medical, dental, and vision benefits for up to 36 months if your group coverage would otherwise end due to one of the following qualifying events: termination of employment for reasons other than gross misconduct, reduction in work hours resulting in a change to your employment status, loss of dependent child status as defined under the terms of the medical, dental, and vision plan, divorce or legal separation from a covered employee, eligibility for Medicare, which affects your health coverage, notification and election of coverage. If a qualifying event occurs, you or an affected family member must notify the plan administrator within 60 days of the event. Once notified, the plan administrator will provide information regarding COBRA continuation coverage options, including details on how to elect coverage and applicable premium payments. For further details regarding COBRA eligibility, coverage costs, and enrollment procedures, please contact the Human Resources Department. Employee safety is our top priority. We are committed to full compliance with the Occupational Safety and Health Act of 1970, OSHA Act, and all applicable OSHA regulations to ensure a safe and secure work environment for all employees. Employer responsibilities under the OSHA Act. Provide a workplace free from recognized hazards that could cause injury, illness, or death. Comply with all OSHA safety and health standards relevant to our industry. Ensure proper safety training and access to information about workplace hazards. Provide necessary personal protective equipment, PPE, at no cost to employees. Conduct regular safety inspections and address identified hazards promptly. Maintain records of work-related injuries and illnesses in compliance with OSHA reporting requirements. Employee rights under OSHA: the right to a safe and healthy workplace, the right to receive training in a language and format they understand, the right to report safety concerns or workplace hazards without fear of retaliation, the right to access safety records, injury logs, and exposure reports, the right to request an OSHA inspection if unsafe conditions exist. If you have any concerns regarding workplace safety, or if you observe any hazardous conditions, please report them immediately to your supervisor or the Human Resources Department. Employees may also file complaints directly with OSHA if safety concerns are not addressed. For more information on OSHA regulations and employee rights, visit www.osha.gov or contact the HR department. We uphold high professional and ethical standards to ensure a safe, productive, and respectful work environment. Any misconduct will be addressed seriously and may result in disciplinary action, up to and including termination of employment. Examples of misconduct, including but not limited to: violation of company policies or safety rules, insubordination or refusal to comply with reasonable directives, unauthorized possession, use, or sale of alcohol or controlled substances on company premises or during work hours, unauthorized possession, use, or sale of weapons, firearms, or explosives on company property, theft, dishonesty, or fraudulent activities, harassment of any kind, including physical, sexual, or verbal harassment, Disrespectful or inappropriate behavior towards employees, visitors, or the public, excessive absenteeism or tardiness without valid justification, engaging in outside work or personal business during work hours, or using company property for unauthorized purposes, poor work performance that does not meet company expectations. This list is not exhaustive, and disciplinary actions will be determined based on an assessment of all relevant factors. Employment at will disclaimer. Nothing in this policy is intended to modify or alter the company's at-will employment policy. Employment remains voluntary, and either the employee or the company may terminate the employment relationship at any time, with or without cause or notice. For questions or concerns regarding this policy, please contact Human Resources. At Prince Charles Home Healthcare Agency, we expect all employees to maintain high standards of personal hygiene and professional appearance at all times. Your appearance reflects not only your professionalism, but also the company's image to clients, colleagues, and the public. General dress code guidelines. Employees should present themselves in a neat, well-groomed, and professional manner. Whether or not your role involves direct customer or client interaction, your appearance and conduct contribute to the company's reputation. Administrative staff dress code. The company observes a business casual dress code on Fridays. Administrative employees should exercise discretion and wear attire appropriate for an office setting and customer interactions. Caregiver dress code. Caregivers are recommended to wear a uniform while on duty. For safety reasons, caregivers must wear closed-toe, non-slip shoes to reduce the risk of injury. A company-issued name badge must be worn at all times while providing care. By adhering to these guidelines, employees help maintain a positive, professional, and safe work environment. If you have any questions regarding dress code expectations, please contact HR or your supervisor. Reliability is essential to maintaining a productive and efficient workplace. Attendance and punctuality are key factors in ensuring the success of both our employees and the organization. As a team, it is important that each employee is present and ready to work as scheduled. Reporting absences and tardiness. If you anticipate being late or absent, you must notify your immediate supervisor as soon as possible, but no later than 2 hours before the start of your workday. Personal matters requiring time off, such as doctor's appointments, should be scheduled outside of working hours whenever possible. Job abandonment. If you are absent for 2 consecutive days without notifying the company, it will be considered voluntary resignation due to job abandonment. As a result, you will be removed from the schedule, and your employment may be subject to termination. For any attendance-related concerns, please communicate with your supervisor or human resources as soon as possible. Commitment to privacy and confidentiality. Our facility is dedicated to maintaining the highest standards of patient privacy in compliance with the Health Insurance Portability and Accountability Act, HIPAA. Any breach of HIPAA regulations can lead to serious legal and professional consequences. Protecting resident information is a fundamental responsibility of all employees, healthcare professionals, volunteers, students, faculty, vendors, and contractors, regardless of job classification or position. Access to protected health information, PHI. While working at or for this facility, I understand that I may have access to or become aware of confidential resident health information, PHI, even if I am not directly involved in the resident's care. I acknowledge that it is my responsibility to maintain the confidentiality of this information at all times. Confidentiality agreement. As a condition of my employment or engagement with the facility, I agree to the following. Non-disclosure. I will not verbally, electronically, or in any written form disclose PHI to any unauthorized person. Restricted access. I will not allow any unauthorized person to examine, copy, or share any resident's medical records, reports, or data files. Authorized use only. I will only access, review, or use confidential resident medical information when it is necessary to perform the duties of my job. Secure handling. I will ensure that all resident medical records, reports, and electronic health data remain secure and inaccessible to unauthorized personnel. Compliance and reporting. If I become aware of a privacy breach or any unauthorized disclosure of PHI, I will immediately report the incident to the privacy officer or compliance department. I understand that any unauthorized disclosure, access, or mishandling of PH may result in disciplinary action, up to and including termination of employment, legal penalties, and/or civil liability under HIPAA regulations. By adhering to these policies, I acknowledge my responsibility in upholding patient privacy and ensuring regulatory compliance. Maintaining the confidentiality of company information is the responsibility of all employees. We have a shared commitment to ensuring that sensitive business information is not improperly or accidentally disclosed. Do not discuss company confidential matters with anyone who is not employed by the company. Employees may be required to sign a non-compete or non-disclosure agreement, NDA, as a condition of employment in compliance with state and federal laws. Any inquiries regarding a current or former employee's position, compensation, or employment status must be referred to Human Resources. By adhering to these guidelines, we ensure the integrity and security of our workplace and maintain compliance with professional and legal standards. Our company's reputation is built on exceptional service and high-quality work. Maintaining this reputation requires the active participation and commitment of every employee. Customers form lasting opinions about our company based on individual interactions with employees. A single negative experience can impact our reputation and influence current and potential customers, including their friends, family, and business associates. It is essential to treat every customer with professionalism, courtesy, and respect. Every employee plays a crucial role in upholding our company's standards of service and fostering positive relationships in all professional interactions. By prioritizing customer satisfaction and professional conduct, we strengthen our brand, build trust, and enhance long-term business success. To maintain a productive work environment and minimize disruptions, the following guidelines apply to solicitation and distribution of materials in the workplace. Employees may not solicit other employees for any purpose during working time, either their own or the other employees. The distribution of literature, including handbills, in work areas is strictly prohibited at all times. Non-employees are not permitted to trespass, solicit, or distribute literature on company premises at any time. These policies are in place to ensure a professional work environment and minimize workplace interruptions. To ensure we can assist you and your family in the event of a personal emergency, it is essential that your contact and personal information remains up to date. Employees should promptly notify Human Resources of any changes, including name, address, or telephone number, marital status number of dependents, next of kin or beneficiary designations. Keeping this information current allows us to provide timely assistance when needed and ensures accuracy in company records. Employees are expected to exercise proper care when using company property and equipment. Unauthorized removal of company property from the premises is strictly prohibited and requires prior management approval. Any loss, damage, or malfunction of company equipment must be reported to your immediate supervisor immediately. Employees are responsible for handling company assets with respect and care to ensure their longevity and functionality. Failure to comply with these guidelines may result in disciplinary action. Employees authorized to operate company vehicles must adhere to all safety, operational, and reporting guidelines. Operators are responsible for the safe operation and cleanliness of the vehicle. Accidents involving a company vehicle must be reported to the administrator immediately. Employees are personally responsible for any moving or parking violations incurred while operating a company vehicle. Company vehicles are strictly for job-related travel and should not be used for personal purposes. Only authorized employees are permitted to operate company vehicles. Seatbelt use is mandatory for both drivers and passengers at all times. Failure to comply with these policies may result in disciplinary action. Severe weather conditions can occur during certain months of the year. While driving may be challenging at times, employees are expected to report to work as scheduled unless extreme conditions prevent safe travel. Time off due to inclement weather must be reported to your immediate supervisor. Exempt employees may be provided time off with pay when necessary to comply with state and federal wage and hour laws. If severe weather requires the closure of the building, your supervisor will notify you accordingly. If the emergency preparedness plan is activated, staff will instruct the caregiver to ensure that clients have adequate food, water, medication, and heat prior to leaving their shift. Family members will be contacted as backup support when necessary. During inclement weather for additional details, please refer to the emergency supply list in your handbook. At Prince Charles Home Healthcare Agency, maintaining a safe, productive, and professional work environment is a top priority. As part of our commitment to workplace safety, we enforce a strict drug and alcohol-free policy. Prohibited conduct employees are strictly prohibited from manufacturing, distributing, selling, or possessing illegal substances or unauthorized alcohol while on company property. During company paid time, inside company-owned or leased vehicles, engaged in company-sponsored activities, reporting to work or remaining on duty, while under the influence of alcohol or illegal substances, consuming alcohol during working hours, including meal and break periods, except when explicitly authorized at company-sponsored events. Compliance and disciplinary action. Compliance with this substance abuse policy is a condition of employment. Any violation may result in disciplinary action, up to and including termination. If you have any questions regarding this policy or need assistance related to substance use concerns, please contact HR or a designated company representative. To maintain a professional and productive work environment, employees are expected to use company and personal devices responsibly during work hours. Unauthorized internet browsing is strictly prohibited. Personal phone use should be limited during work hours to ensure focus on job responsibilities. Misuse of company devices or excessive personal phone use may result in disciplinary action. At Prince Charles Home Healthcare Agency, we recognize the importance of effective communication among employees and with customers. To support this, we have implemented an internal email system to facilitate the secure and efficient exchange of business-related information. Permitted use. The email system is strictly for business purposes and should be used for work-related communication only. Prohibited use employees are not permitted to use company email for personal solicitations or promotional activities, distributing non-work-related content to fellow employees. Failure to comply with this policy may result in disciplinary action. If you have any questions regarding email usage, please contact your supervisor or IT support. Preparedness is essential to ensuring swift and safe actions in critical situations. All employees should be familiar with the following emergency protocols. Fire and evacuation procedures. Remain calm and follow the designated evacuation routes posted in your work area. Assist clients or coworkers as needed, ensuring their safe exit. Do not use elevators during evacuation. Proceed to the designated assembly area and wait for further instructions. Medical emergency response. Immediately call 911 for serious medical emergencies. Provide basic first aid if trained and only if it is safe to do so. Report the incident to a supervisor or designated emergency coordinator as soon as possible. Contacting emergency responders, dial 911 for fire, medical, or security emergencies. Clearly state your location, nature of the emergency, and any critical details. Notify management and follow any additional company protocols. By staying informed and following these procedures, we can help ensure a safe and effective response to emergencies. If you have any questions about emergency preparedness, please contact HR or your supervisor. Ensuring the health, safety, and well-being of our clients is a top priority. Employees responsible for client care must remain alert and attentive throughout their shift. Unacceptable conduct and consequences. Any employee found sleeping while on duty is engaging in unacceptable personal conduct that jeopardizes client safety. Confirmed instances of sleeping on duty will result in immediate disciplinary action, up to and including termination. Medication and illness reporting employees must notify their supervisor and request leave if they are taking medication that causes drowsiness or affects their ability to perform their duties, are experiencing illness or fatigue that may impair their ability to stay awake while on duty. Employees will be approved to return to work once they are no longer affected by medication or illness that may cause drowsiness or impair their performance. By following this policy, we ensure the highest level of care and professionalism for our clients. For any concerns regarding this policy, please contact your supervisor or HR. At Prince Charles Home Healthcare Agency, maintaining professional integrity and ethical standards is essential. As part of our commitment to ethical care, Employees are strictly prohibited from accepting any form of gifts, donations, or compensation from clients in exchange for services. Prohibited actions. Employees must not accept gifts, money, clothing, jewelry, household items, or any other tangible goods from clients. Soliciting, requesting, or charging clients for additional compensation beyond agency-approved payments is strictly forbidden. Reporting and consequences. Any allegation or suspicion of an employee soliciting or accepting gifts, donations, will result in a thorough investigation. Employees found in violation of this policy will face immediate termination. Any concerns regarding gift solicitation should be reported following the agency's complaint policy. By adhering to this policy, we ensure a trust-based, ethical, and professional caregiving environment. If you have any questions, please contact HR or your supervisor. Summary of patient rights and employee responsibilities. For a complete list of patient rights and responsibilities, please refer to your employee handbook. As a healthcare provider, it is your responsibility to uphold and respect the rights of all patients. The following guidelines summarize key expectations. Treat all patients with respect, dignity, and courtesy at all times. Handle personal property with care to prevent damage or loss. Provide care that is competent, professional, and in line with your training and qualifications. Maintain a safe environment free from physical, mental, verbal, sexual, emotional, material, or financial abuse, as well as any form of harassment or intimidation. Communicate in a manner and language that the patient can understand. Avoid any actions that could be perceived as abusive, neglectful, or exploitative. Show professionalism and courtesy when entering a patient's home, always acknowledging their presence and respecting their space. Refrain from becoming argumentative with your patients. All instances of potential abuse, neglect, or exploitation involving any employee must be reported immediately to the Elder Abuse Hotline. By adhering to these principles, you help ensure a safe, respectful, and professional environment for all patients. For further details, please review the full Patient's Bill of Rights in the Employee Handbook. At Prince Charles Home Healthcare Agency, LLC, we are committed to the protection and well-being of all clients. Employees must adhere to the highest standards of care and report any concerns regarding abuse, neglect, or misappropriation of property immediately. Definitions of abuse. Any knowing and willful act that causes physical injury, pain, or distress to a client. This includes unjustified use of physical restraints, confinement, or punishment that compromises the client's health and safety. Incapacitated adult. Any individual aged 18 or older who, due to mental illness, intellectual disability, physical illness, disability, advanced age, or other factors, lacks the ability to make or communicate reasonable decisions regarding their well-being. Neglect. The knowing and willful failure to provide necessary treatment, care, goods, or services, resulting in harm or endangerment to the client. Responsible person. Any individual who has assumed care, custody, or control of an incapacitated adult, whether by law, contract, or voluntary agreement. Who this applies to this policy applies to all employees providing full-time, part-time, or intermittent care to adults, including but not limited to companions, chore workers, homemakers, personal care aides, PCAs, certified nursing assistants, CNAs, licensed practical nurses, registered nurses. Employee responsibilities and reporting. Employees must report to their assigned cases scheduled. Leaving a client unattended before the end of a shift without proper notice or failing to report a missed shift to the agency may be considered client abandonment. Any suspected abuse, neglect, or misappropriation of client property must be reported immediately following the agency's reporting protocol. Legal and disciplinary actions. Failure to adhere to this policy may result in a reportable offense to the Department of Social Services, Adult Protective Services, APS, for personal care aides, PCAs. CNAS found violating this policy will be reported to the Board of Health Professions for further investigation. Nurses found violating this policy will be reported to the Board of Nursing. Employees under investigation may be suspended without pay pending the outcome. Criminal charges. Any confirmed case of abuse, Neglect or theft involving a client may result in criminal prosecution, fines, and/or imprisonment under state and federal law. We are committed to ensuring the safety, well-being, and accountability of our employees and clients. As part of this commitment, all incidents, accidents, or occurrences that interrupt normal procedures or create potential risks must be promptly reported and documented. Employee responsibility. All employees are required to report any and all incidents to ensure a safe and effective work environment. Failure to report an incident may result in disciplinary action. Guidelines for incident reporting. All incidents must be reported to the appropriate administrative personnel immediately. Incidents involving nursing or personal care staff and/or clients should be reported directly to the registered nurse (RN). All employees involved in an incident must be reported to the Human Resources Director or the RN for further review. Clients and employees should report all incidents as soon as possible to ensure a timely response and resolution. By adhering to this policy, we maintain a safe and compliant workplace while ensuring that all concerns are addressed promptly and appropriately. Caregivers are not permitted to transport clients to any destination or appointment without prior approval from the RN supervisor, staffing specialist, or administrator. Caregivers do not provide transportation for clients. Clients requiring transportation to medical appointments must arrange for family or alternative transportation. Caregivers may accompany clients on outings and appointments to assist with personal care needs. Caregivers are not allowed to ride in a vehicle driven by a client. Caregivers may run errands on behalf of the client once per week, following the care plan guidelines. These policies are in place to ensure client safety and compliance with healthcare regulations. It is the policy of Prince Charles Home Healthcare Agency to maintain the client's property and belongings in the order or manner or condition in which it was found. The purpose of this policy is to determine responsibility of all lost or damaged personal property of clients of Prince Charles. Prince Charles will not be held liable or responsible for the client's personal property or valuables. All clients are required to sign consent to receive services with the signature indicating they accept this policy. However, under circumstances that are proven that the client's personal property was damaged knowingly or accidentally by an employee of Prince Charles, the employee will be held totally responsible for the replacement of damages made. All clients are responsible for providing supplies needed for the aide to launder their clothes. It is the responsibility of the client to give information on how they would like the aide to launder their clothes. Prince Charles will not be responsible for any lost, damaged, nor stolen clothing. In the event of theft, the responsibility of the alleged offense will be handled between the client and law enforcement. Please review the chain of command as outlined in your employee handbook. If you have any questions regarding your reporting structure, contact the office for clarification. For assistance, follow the appropriate chain of command. Staffing coordinator, your first point of contact for scheduling and general work-related concerns. Human Resources Department, for employment policies, benefits, or workplace concerns. Nursing supervisor, for clinical and patient care-related inquiries. Administrator, if further escalation is needed beyond your nursing supervisor. Following this structured chain of command ensures that your concerns are addressed efficiently and appropriately. If you need further clarification, do not hesitate to reach out to the office. Inactive status and voluntary resignation policy, shift refusal and inactive status. Employees who decline 2 or more shifts or cases will be placed on the inactive list. To return to active status, employees must formally request reinstatement and accept available assignments offered by the agency. Inactive status duration and voluntary resignation. Employees who remain on the inactive list for more than 60 days will be considered to have voluntarily resigned from their position. Individuals who wish to return to employment after voluntary resignation must submit a new application and restart the hiring process. This policy ensures operational efficiency and maintains a consistent workforce to meet client needs. If you choose to resign from the company, we encourage you to participate in an exit interview as part of the formal resignation process. Additionally, please ensure your address is updated to receive any tax-related documents throughout the year. Resignation guidelines. 2-week notice. A written 2-week notice is required for all voluntary resignations. Return of company property. All company-issued property must be returned before your last working day. Final paycheck. Your final paycheck will include all owed compensation in accordance with company policy and applicable labor laws. If you have any questions regarding the resignation process, please contact the Human Resources Department. Termination policy. Prince Charles Home Healthcare Agency has established the following guidelines for voluntary resignation and involuntary termination of active employees. The purpose of this policy is to ensure employees understand their employment status, expectations, and required procedures upon termination. Responsibilities upon termination. When an employee leaves the agency, both the supervisor and the Human Resources Director must complete specific tasks. Completion of documentation. The supervisor must use the termination/resignation checklist to ensure all required paperwork is completed and that all company property is returned. Submission of reports. The supervisor must complete an employee termination report and an employee action form and submit them to Human Resources within 1 pay period following the employee's last working day. Exit interview. Employees are required to attend an exit interview to discuss the reason for termination, except in cases involving threats, verbal or physical, or theft from the client or company, in which Prince Charles reserves the right to waive the exit interview. A. Voluntary termination. Voluntary termination may include leaving Prince Charles for another employer, retirement, relocation, or employment with an affiliated organization. Employees are required to provide a written resignation submitted to their supervisor at least two weeks before their last working day for non-nursing staff. A 4 weeks notice for employees within the Department of Nursing to ensure continuity of care. B. Involuntary termination. If an employee is involuntarily terminated, they will be notified immediately, either verbally or in writing, depending on the circumstances. The termination will be documented in the employee's Human Resources personnel file. Post-termination access. Once terminated, employees must not return to Prince Charles premises without prior permission. Final paycheck. All owed compensation will be processed and issued via direct deposit or mailed to the employee's address on file. C. Employee death. In the unfortunate event of an active employee's passing, the Human Resources Director is responsible for notifying the beneficiary of any applicable insurance plans, releasing any wages and/or property owed to the deceased employee's estate, ensuring the completion of all Prince Charles records related to the deceased employee. For further clarification regarding this policy, please contact the Human Resources Department. For all staffing and client emergencies outside of regular business hours, please contact the after-hours emergency number at 743-242-8976. Appropriate use of the after-hours number. Report staffing emergencies. Notify of client-related emergencies. Request shift changes or cancellations. Provide urgent updates. If the after-hours number is unavailable, please use ERSP to send a message to any member of the administrative team. The after-hours line is available 24/7 for emergencies only, during normal business hours. Please refrain from using the after-hours number and instead contact the office. For non-urgent matters, kindly wait until regular business hours. Key reminders. Scheduling and EVV compliance. If you have any questions regarding your schedule or the EVV system, please contact the office. Attendance and shift cancellations. If you are unable to work your scheduled shift, notify the office as soon as possible, but no later than 2 hours before your shift. Failure to provide prior notice may be considered client abandonment and could result in disciplinary action. Workplace safety and client environment. If you ever feel uncomfortable or unsafe in a client's home, contact the office immediately. You have the right to remove yourself from any environment that is unsafe, unsuitable for care, or where harassment occurs. Your safety is our top priority. Family members or children are not allowed to be present in the client's home. Do not consume the client's food, snacks, or drinks. Do not take or use the client's debit cards, EBT cards, or other financial resources without explicit permission. Any items purchased on behalf of the client must be returned to them immediately after the transaction. Thank you for attending orientation at Prince Charles Home Healthcare Agency. We appreciate your commitment to delivering high-quality care.